ADHD and autism assessment waiting times are being artificially extended to a minimum of 2 years in at least one area of England, and so far I cannot find anyone covering this. More than half of integrated care boards, they commission local NHS services, have already placed limits on ADHD assessments when they're carried out by independent providers under the NHS Right to Choose scheme. This was covered extensively in the press last year and early this year, but this is the first time I've seen an ICB set arbitrary minimum wait times for assessment, even though the providers have capacity to see patients sooner. Right now, this only affects people living in West Yorkshire as far as I can tell, but other areas will be watching with interest because ICBs have been forced to halve their running costs, leading to massive redundancies. They are under unbelievable financial pressure as part of the NHS restructure and the scrapping of NHS England. Despite knowing that the country faces £17 billion in avoidable costs every year due to undiagnosed and unsupported ADHD, public services are increasingly prioritising short-term cost savings due to insufficient funding and resources. If this goes unchallenged, this might be a turning point in patient rights under the NHS Constitution. I've spent the last few days investigating. Here is what you need to know and what you could do if you're affected. If you're not familiar with Right to Choose, it isn't specific to ADHD and autism services. The NHS Constitution sets out a patient's right to make choices about their care, including the provider. For some NHS services, your GP can refer you to an NHS-funded provider instead of simply referring you to their local NHS service, particularly where there is a very long waiting list. And this is mutually beneficial. It reduces pressure on NHS services and waiting lists, and it helps patients to be seen more quickly. The right to choose has been exercised by a growing number of patients for ADHD and autism assessments in recent years because local NHS services have not had capacity to meet need. Independent providers have filled this gap, and ICBs have been encouraged to make use of these services to reduce their own waiting lists. Patients have chosen this because it's often the only way to access an NHS-funded assessment within months rather than years. And if you've been following ADHD services over the last year, you'll know that many areas have restricted access to these providers using something called Indicative Activity Plans, or IAPs. These are agreements between integrated care boards and independent providers, which limit the number of assessments they can carry out in a financial year. They are controversial because providers have capacity to carry out assessments sooner, and patients in other areas can be assessed sooner. But patients in these areas face longer than necessary waits. That is precisely the sort of postcode lottery that the NHS should be working to resolve. So while restrictions on right to choose aren't new, I cannot find another ICB setting a minimum wait time like West Yorkshire has, and this is much more concerning. Right to Choose has increased assessment capacity without the NHS services having to invest more into their own service or recruit more staff, but that has also meant increased costs because the number of assessments funded by the NHS has grown enormously. Even if these private assessments cost the same or even less than NHS assessments, and we have no clear data on that, spending will increase because more people are being assessed. And it's important to understand the NHS context here. NHS England is being abolished, integrated care boards have had to cut running costs by 50%, and these ICBs are merging into larger regional clusters, departments and roles are merging, and thousands of staff are being made redundant. Decisions are increasingly driven by insufficient funding and resources rather than responding to the needs of the local population as they should be. To see just how inequitable this actually is, have a look at this page from Right to Choose provider Innovate ADHD. They say their average waiting time for assessment is 1 to 3 weeks. This means the provider has plenty of capacity to assess and support patients who are referred. Then they list the ICBs who use activity plans to restrict the number of assessments they can do in a year. They say patients in these areas should expect a long wait. But then you reach the West Yorkshire information. It explains that West Yorkshire ICB has introduced a minimum waiting time of 2 years. If we then look at West Yorkshire's own information, it says the purpose is to equalise waiting times and that patients choosing independent providers will have to wait at least 2 years before they can be assessed. They do have a mechanism for those deemed to require urgent assessment, but with an aim to be seen within 12 weeks, and it's unclear what the thresholds are to qualify. They did an equality impact assessment on capping assessments under an IAP last year, but there's nothing published on this decision. This is a significant shift in policy and it goes way beyond annual limits, because even if the provider is within their annual limit for West Yorkshire, they will simply not be allowed to assess any of their patients until 2 years have passed. NHS and government policy usually aims to reduce waiting times. I have never seen the NHS deliberately increasing waiting times and claiming this is about fairness. And it isn't, because if patients just outside West Yorkshire can access an assessment in 1 to 3 weeks, and someone just inside has to wait 2 years despite available capacity, there is nothing fair about that. And if everyone in West Yorkshire has to wait roughly the same amount of time, what practical benefit does the patient's right to choose provide? Will more people just choose to wait on the local NHS waiting list? And if that happens, what will be the impact on those waiting lists? If you're feeling deja vu, you are not alone. Those of you who follow my work on Send have heard me saying exactly this for years. Public services are vastly underfunded and under-resourced, and need is growing faster than funding and service capacity. The independent sector then fills that gap, and public services are encouraged to make use of it. This capacity becomes a workaround or a hack for a lack of investment in public services. That improves access, but it also increases costs, not only due to privatisation, but from supporting people who would otherwise be waiting, just as in Send services. Eventually, the costs make investment into public service impossible, and then services fall into vast debt. And instead of addressing the underlying lack of capacity, restrictions are then imposed. We've seen it happen with specialist schools and with transport, and now NHS neurodevelopmental services. It is a false economy in every case. The needs don't disappear when you fail to meet them. There is a prominent false narrative around ADHD overdiagnosis, so some people will believe these assessments are just not necessary at all. But the government's own independent ADHD task force reached the opposite conclusion. Not only is ADHD still significantly underdiagnosed, the task force estimated that unidentified and unsupported ADHD cost the UK economy at least £17 billion every year in avoidable costs. Its recommendation was an invest to save approach. Identify people earlier, support them earlier, and you reduce the much larger long-term costs associated with untreated or unsupported ADHD. The evidence suggests that earlier diagnosis and support saves money in the long term. Does this sound familiar to you? Integrated care boards are under pressure to reduce their spending now, and long-term impact and costs are considered someone else's problem, just like the Send reforms. Now, I am not a lawyer, so I'm not saying that this is unlawful policy, but it is reasonable to ask whether introducing a blanket minimum waiting time unnecessarily changes the basis of a patient's right to choose. That's a question that NHS England, or soon the Department for Health and Social Care, really needs to answer. At this stage, I do not know if West Yorkshire is the only ICB who set an arbitrary artificial minimum wait, or if they're just the only ICB who've publicly admitted that that's what they're doing. We don't know what evidence they used to make this decision, whether they did an impact assessment or obtained legal advice. My main question is whether NHS England approve of this approach, given they were very clear that restrictions should not limit patient choice of provider. If this becomes the direction of travel, it will have serious implications for patient rights and access to services. If you live in West Yorkshire and are affected by this policy, I would recommend writing to the West Yorkshire ICB, asking about equality impact assessments, asking about the basis for the decision, and contacting one of the relevant national charities for advice, possibly also seeking legal advice. If you know of another integrated care board that's doing the same thing, please send me the evidence. I'll be keeping a close eye on this. I don't think we've heard the last of it.